Hi, everyone. My name is Megan Muller, and I will be talking with you all about sexual issues in older adults. And I hope that you enjoy the presentation. I found this cartoon. I thought it was a little bit silly, and so I thought I'd share it with you all. Thought you might get a little kick out of it. So I chose this topic of sexual issues in older adults because I found that it just to be an interest of mine. And as I age and get into my 40s, these are some things that I think about on occasion and have a feeling that I will need to address at some point in my life. And so I think it's important for all of us to consider these things, and perhaps they will one day affect us and also our clients as well. So today I'll be talking to you about the background and history of sexual issues in older adults. I'll review some of the issues associated with sex and sexuality as we age, and I'll present some unique and interesting findings in the research that I did. I'll also talk about, in general, what I learned, and then some implications from a clinical aspect in terms of counseling. So I'm not sure if you can see this, but let me move my screen over here. So I found it interesting that there are age brackets when it comes to defining older adults. So older adults, I found, are considered to be over the age of 65. And then they go into the young adult, which is between 65 and 74. And then old is considered 75 to 84. And then the oldest old is over the age of 85. So before doing research, I had no idea that these age brackets and definitions even existed. So in terms of aging and ageism and sex, I found a lot of interesting information about just ageism in general, but also associated to sex and what people think about sex and older adults. So typically our society believes that older people just don't have sex. So they're asexual. They don't want to have sex. It's not an interest of theirs. It's not a desire. They don't want, they don't think about it. And people even associate old age with not being able to get an erection, women not being able to produce enough lubrication for sexual intercourse, and even in some cases, people associate age and sex with just people not being able to move around in order to perform sexual activity. Also, I found in the literature that a lot of people think that older women are typically believed to be unattractive and that older sex is disgusting. I remember when I was a kid thinking that the idea of my parents having sex was just mortifying and very disgusting. So I can see how younger generations would feel that way. The media also portrays older adults as subjects of humor in a physical, cognitive, and sexually impotent sense. And so the media often pokes fun at older adults as being impotent and not interested in sex or unable to have sex. And the LGBTQ community and the older population is completely absent from the media. So you don't even see that at all, according to the research that I did. But more recently, it seems that Western society sort of marks aging and sex as a sort of like result of successful aging. So if you're older and you're able to still have sex, then you've successfully aged. And so there's this sort of paradox where it's gross and disgusting, but if you can have it, then you've somehow hit the mark. Move my screen again. So the common challenges among older adults in terms of sexual activity are mostly medical. So what I found in the research is that age was not really considered a factor in terms of the challenges that people felt, age itself. So someone who's 65 or 80 didn't really consider the actual chronological age as a problem. What was a problem were all of these things that I have listed here. So medical issues included a variety of things, but the most common are cardiovascular disease, diabetes, and cancer, specifically prostate cancer and breast cancer. These diseases affect sexual functions and the ability to have sex, and in turn, affects psychological aspects of health as well. So some depression can set in, anxiety, and just general sort of men I found felt anxiety over performing and whether or not they would be able to get an erection. And so that created some anxiety for them. Women felt sort of disheartened that sex was painful for them. And so many of the women had sex with their partners anyways, even though it was very painful. So there's a lot of psychological components that go into older people and when it comes to sex. Older people in general tend to take more medication. And so when we take medications, obviously there's side effects. And so that can affect erectile dysfunction. It can create erectile dysfunction. It can cause all sorts of other medical issues, and in turn make it difficult to have sex. A big one for barrier for people having the sex that they wanted was the loss of loved ones, and so more specifically the loss of a partner. This was the number one determining factor regarding whether or not a person would have sex or not. It's not that they didn't want to, it's just that they didn't have a partner to share that with. So that's a big challenge for adults, is losing people they love. The living environment is also another important consideration. Many older adults enter assisted living, housing. Sometimes they live with their family members. So there is a lack of privacy, and a lot of the assisted living facilities don't encourage sexual relations inside the facility. And so there's some lack of independence in terms of being allowed to make decisions about their living environment and whether or not they're sexually active in those places. And I mentioned loss of independence. As we age, we start to not be able to drive, our decision-making abilities go down, and thus other people start making decisions for us. We become more financially dependent upon other people to pay our bills, and just daily living becomes harder. Going to the store to go shopping, and just enjoying the things that we used to enjoy diminish as we age and as we become less mobile. Dementia is also another big consideration in terms of memory loss and cognition. That affects our ability to make decisions about sexual partners, being able to connect with the people that we love. Again, and also physical abilities tends to decline. Things that are usually easy to do in terms of your activities of daily living, like walking, sitting, standing, stairs, etc., become more difficult. Many older adults feel their self-esteem has decreased because they can no longer do the things that they used to. And then being able to advocate for oneself decreases as well. So all of these factors play a part on a person's sexual interest and availability. So I talked a little bit about ageism already, but I do want to touch on the generational differences that have been noticed over time. There was a bit large scale, longitudinal scale study of 70-year-olds that indicated a decrease in the proportion of men reporting erectile dysfunction, but an increase in ejaculation difficulty. And women reported having an increase in orgasms during intercourse and a decrease in the number who said that they had never had one. So this speaks to sort of the generational differences over a long period of time. The study that I'm referencing was carried out over 4 different time frames, 1971 to 72, 1976 to 77, 92 to 93, and 2000 to 2001. And these were with the same people. So their attitudes about sex changed over the generations. And so as we've aged and as society has changed, our views on sex has changed too. There's also some cultural implications that I'd like to touch on. It was difficult to find literature about specific cultures, but I did find one study from India that was very good, that indicated the beliefs of that society was that sex was only to be had for reproductive purposes, and that sexuality in old age was wrong and amoral. And I'll quote from the Dhingra study, quote, there was a general sense of guilt, fear, shame in anticipation of negative reactions from family members, especially children. So, end quote. So that in that culture, sex is looked at as being amoral or wrong in old age. So there are definite cultural implications when it comes to old age and sexuality. Some of the common medical issues that older adults face, and these are just a short list: cancer, diabetes, cardiovascular disease, hormonal changes, arthritis, medication side effects, osteoporosis is another one. So there's a plethora of medical conditions that arise as we age, and all of those medical conditions affect us physically. And we often take medications that have side effects that affect our ability to engage in sexual activity. The most common reasons for medical problems becoming an issue when it comes to sex was for men, and that was the biggest and most common medical problem was cardiovascular disease. There's a link between cardiovascular disease and erectile dysfunction. Also, another one that was very common was prostate cancer, and again, that affects the ability to get an erection. For women, it was going into older age and experiencing hormonal changes related to menopause. And so what happens with that is women, their ability to produce vaginal lubrication goes down, and so they need to take other medications and ointments, lubes to increase the level of lubrication when that happens. There's significant psychological issues as well that occur in old age. Depression, anxiety, life changes such as retirement, death of a loved one, loss of a spouse, loss of privacy, embarrassment, loneliness, frustration, and fear of performance. So I read a study, was very well done, talked about people's feelings about, as they've aged and as a partner has started to experience difficulties in being able to perform sexually, the effects that has had on them. And they were really quite profound. And what I discovered is that when the communication is not there, people are less likely to talk about sex, to talk about the problems they're having, to come up with solutions, to show care and love for each other, even in times when it's difficult. And so there's this sense of built up resentment and animosity. And in some cases, there are people who just aren't willing to go to the doctor to seek help. And so that further creates animosity. So there's definitely a huge impact on relationships when sexual issues become a problem. So in terms of attitudes and behaviors towards sex in older adults, what I found in the research was that, in general, older adults, they want to have sex. They want to have it as much as they used to before when they were younger, but it's less important. And so things like cuddling, being close to each other, holding hands, kissing, touching, seem to be, in the research, what people really wanted, more so than intercourse or oral sex. That seemed to be sort of secondary, although they were definitely open to the idea. But the general closeness is what they were really looking for, the close bond in the relationship. There was a study in a sample of 80 to 102-year-olds, 62% of men and 30% of women reported having sexual intercourse at least sometimes. 83% of men and 64% of women reported touching and caressing sometimes. So older adults, even in the 80s to 100, are physically, sexually active, at least sometimes, which may be surprising to some of you. But again, they over and above, they want a close emotional relationship. So, and the reason they wouldn't, so I mentioned that they want to have sex more, but the most common reason they didn't have sex more was because they had a loss of a partner. And what I found interesting too is that masturbation and intercourse were generally not something that they wanted in 80 and up adults. 66% of people in this age range between 80 and 102 were satisfied with the amount of sexual activity they were having, and 50% reported using condoms most of the time or all of the time. So I want to talk about the doctor-patient relationship because I found a lot of research on this in particular, and I think it's important to mention because I do think it kind of bleeds into the counseling role as well. So what I found is that in general, the physicians are not trained on how to address the topic of sexual issues, especially in older populations. They had no problems talking with younger people about safe sex, and were very open to talking about sex in general with young people. But as people get older, they're uncomfortable talking about it. And I think it is because society has this ageist view that old people don't have sex. And I do think that bleeds into the medical community as well. And so, and the research suggested that as well. What I found is that doctors really don't address sexuality unless it's brought up by the patient. And when it's brought up by the patient, it is very medical in nature. So the doctor doesn't want to take time to talk about the emotional aspects of sexual issues. He or she just wants to address the medical part of the problem. So often prescribing medications, much more often than offering counseling. And actually patients aren't comfortable bringing it up either, especially older adults. They just feel like they're wasting the doctor's time. They think that it's not an issue that the doctor can address. And they don't, some of them just didn't think that their sex issues were a problem at all. And so they didn't feel like it was necessary to bring it up. Some of the treatment options that are available for sexual issues are medications, which we talked about for erectile dysfunction and hormonal changes in women using estrogen cream. There are penis pumps and vacuum devices out there that help to sort of allow men to have stronger erections. There are injections and prosthesis are a possibility, although I did not do further research on what exactly that is, although I do know that there can be implantable devices placed in the penis. And I'm not exactly sure if there's other materials that can be used as well. And then lastly, the least recommended treatment option by physicians was sex therapy, although they did address it occasionally. So overall, what I took away from this research is that most older adults desire and do have sex on a regular basis, which means at least once per month. Common barriers to having sex were, number one, lack of a partner, medical problems, medication interactions, being embarrassed, the partner not being willing to get help, and lack of partner communication. Medically, the men had prostate cancer, and that produced erectile dysfunction. In women, it was menopause, vaginal dryness, loss of interest, and decreased orgasm intensity. I also learned that sex doesn't always mean intercourse, oral or anal sex, and that intimacy for this age group is key, and having a strong, close bond with their partner was most important. This also included touching, hugging, and kissing. And actually, I read a study on the effects of physical activity on sexual activity, and there is evidence that the more physically active you are, typically the more sexually active you are. Exercise, as we know, increases certain chemicals in our body that make us feel good, and so we're more likely to have the desire to engage in sex. Plus, it helps us physically as well, to perform sex also. They did find that vigorous activity at least once a week had a greater effect on the likelihood of engaging in intercourse or sexual activity than did no exercise at all, light activity, or moderate. So vigorous activity seemed to be the key. I also learned that medical providers are just really not equipped to address sexual concerns. They're very uncomfortable with bringing up the topic. Some of the doctors felt like they would be intruding or broaching a very sensitive topic, so really just didn't bring it up at all. And that most people do not seek help from a counselor. Some interesting and unique findings. I think the biggest thing that I found interesting was that just the lack of confidence and comfort level with physicians in addressing sexual concerns with the older population. It was just kind of surprising to me. And I do think that it goes along with the ageist attitudes and beliefs that old people don't enjoy sex and aren't having it, and so why talk about it? Their first line of approach to treating sexual dysfunction seemed to be pharmacology and not counseling. And I found this to be not surprising, but kind of disappointing. It just kind of goes to show that physicians have a different approach, and they're very much medically based. So also what I found in terms of medical providers, they're very crunched on time. They have very little time to see a patient, and typically there's a long list of problems, especially with older adults who have lots of different conditions and medications that are interacting with each other. And so they always felt like those things took precedence over talking about sexual concerns. And so I just found that this research in general was interesting, and it gives us an opportunity to make some changes for the future. Some other interesting findings were that the psychological impacts of sexual issues in older adults is very profound. Men typically associate their ability to get an erection with their identity, especially gay men. Their penis really was their identity, according to one of the studies that I read. And if you can't have an erection, and that is tied to your identity, it creates a lot of challenges psychologically. There's a lot of frustration within relationships when these challenges happen. There's rejection, fear of failure, depression, performance anxiety, and perceiving pain. I found it interesting, too, that women were more likely to suffer the consequences of sex for the sake of their partner's satisfaction. And what this means is that when women are affected by sexual issues such as vaginal dryness, they were willing to go through with sexual intercourse even though it was painful for the sake of their partner, because they felt it was so important. But the same wasn't true the other way around. Love and commitment were more important than the sexual difficulties within a relationship in general. So that close bond really does hold a couple together, and it far outweighs the frequency or ability to have sex. Also, I found it interesting that having a wide range of sexual behaviors improved sexual relationships, regardless of sexual orientation. And so, what I'm referring to here is thinking about sex in a different way, not just intercourse or oral sex or anal sex, but in things like touching and caressing and masturbation and other things that can connect a couple, but not necessarily um, require all the parts to be functioning. And actually, I did read an article that talked about lesbian relationships and how lesbians tend to have a much better time with this part of it because they already have a wide range of sexual behaviors. So in terms of clinical implications from a counseling perspective, the research addresses the needs for counselors to broach this topic early on in the counseling process. So at intake would be a great time to ask about any sexual issues right from the get-go so that these issues can be addressed and talked about, and solutions can be made outside of the pharmacology realm. It's important to remember that many people are embarrassed to talk about sexual issues. There tends to be a lot of shame and guilt around not being able to perform or not having the desire or ability to have sex, especially when our partner wants to and you don't. And so there's a sense of embarrassment for men specifically, talking to their medical providers about erectile dysfunction. Ageism in sex is real. So we all sort of carry biases and have beliefs about certain people. But as counselors, I think it's important to be careful to not make assumptions as we see older populations. And it's probably safe to think that, at least from the literature, that most older adults want and do have sexual relationships, although they may not be sexual relationships like we think. Maybe it may be touching and kissing and other things. It might not be intercourse sex as we often think of. There's a lack of research and education in the areas of non-heterosexual populations, cultural implications, non-white and non-religious sectors. So all the research that I did addressed the fact that there needs to be more research and education in these areas. So I found that to be a common theme across the board. Something else to keep in mind when we're seeing our patients is that a lot of times these issues that people come to us with are treatable. There are medications and therapies that can help alleviate some of the symptoms that people feel, or if there isn't a solution, there are other activities and ways for people to enjoy sex without having to always use intercourse as the only way. So I think getting creative and talking about likes and dislikes and just having, fostering that open communication can be really helpful. And sex means a lot. Sex means different things to people. And so, and some are not having it. So some of the older people that we see in counseling, they just don't want to have sex, and that's okay. So again, this goes to show that they're, in general, older people want to have sex and do, but there are some that don't. And we, as counselors, respect that and foster whatever avenue they want to take. And that is the conclusion of my presentation. I hope you enjoyed it, and feel free to reach out to me if you have any questions. Thank you so much.